Hi, welcome to Neuro-Meridian.net. My name is Poney Chiang. I'm the founder and director of the Neuro-Meridian Integrative Acupuncture Training Program. On this website, you'll find information about our program content. Also, there are some sample teaching videos that you can watch on both the practical and didactic portions of the course. In this video, I would like to spend the next few minutes explaining how this program came to be and why I feel such a sense of mission to share my research and skills with those fellow practitioners that are interested in becoming proficient in their ability to treat neuromuscular painful conditions. Back when I started Oriental Medical College, I was equally interested in acupuncture and herbal medicine. But not long into the program, I started hearing from senior students that the style of acupuncture that we learned at school, which is TCM style of acupuncture, was actually mostly an herbalist version of acupuncture. So even as a student, I was a little bit curious. Why would I spend time studying an herbalized version of acupuncture when I was already focused on studying herbal medicine as part of my training program? So this would shape the way I approached Chinese medicine. And even after I graduated, I chose to focus my graduate studies in internal medicine and herbal medicine. After I started building my practice and was able to help a lot of patients with their internal problem with herbal medicine, a lot of these patients wanted to refer their friends and family to see me. And oftentimes they would ask me, do you treat painful conditions with acupuncture? And I said, yes, I had studied acupuncture in school. So I was happy to take these referrals, but not surprisingly, I wasn't very good at treating these painful conditions. My success rate was only about 30–40%. So I asked myself a very simple question. Why is it that the general public expect an acupuncturist to be able to treat painful conditions, but instead we spend hundreds of hours focusing on treating internal conditions with acupuncturists, when we really should be spending that amount of time learning how to assess and treat neuromuscular pain problem with acupuncture? So to improve my ability to treat pain, I went back to study Eastern styles of acupuncture and Western styles of acupuncture. I even studied other needly related areas such as anesthesiology and physiatry. I dug up my old anatomy textbooks. I went back to study the Chinese medical classics in its original Chinese, focusing on the two most important texts, the inner canon as well as the systematic canon, which is the first acupuncture manual that we have inherited to date. And I began to cross-reference the neuroanatomy information with the ancient locations described in the systematic canon. And that's when an amazing trend started to unfold. Point after point, I began to realize that the ancient systematic classic authors had a greater understanding in their precision of the traditional acupuncture points over neuromuscular structures than our modern point locations. Approximately 1/3 of the points described in the original systematic canon has since drifted in our modern location. And I think the reason why it would have been very difficult for other researchers to have come to a similar conclusion as I have is because of two reasons. Number one, they were probably using only modern point locations, whereas I focus on the original canonical locations from the systematic classics. Number two, most researchers probably rely on standard anatomy textbooks. As my understanding of neuromyofascial grew, I became frustrated by the either incorrect or imprecise contents of your typical anatomy textbooks. I've had to refer to the primary sources by which are peer-reviewed journals to find the information that I needed to do this cross-referencing. So by having really examined the ancient acupuncture canons and really examined the most recent, up-to-date, no more than 10 years of neuroanatomy research, I was able to rediscover what the original intentions of the original acupuncturists were. Once I started decoding the neuroanatomy behind the canonical point locations, it became clear that the ancient acupuncturists were most interested in stimulating the nervous system through direct acupuncture stimulation of the nerves. This discovery became a chain reaction. Point after point it became clear that the neuroanatomy was precisely located at the canonical point locations, and usually the modern point location would be slightly off or completely off from these locations altogether. Having understood the original intentions of the original acupuncturist, that would change the way that I read the acupuncture classics. Previously, paragraphs from the classic that were amorphous or ambiguous became easier to understand when you start to read it from a neurological understanding. I became able to improve my palpation skills because I knew that the point of the acupuncture was trying to palpate for nerves. By applying this new approach, I have 90% confidence in my ability to treat pain problems. I'm able to help patients who have had chronic pain for more than 5 years. We get medical doctors that refer patients to my clinic now. As an educator, I'm especially interested and happy to see that my students who are practicing this integrative system are getting better results. Right? This discovery that I've accidentally stumbled upon has completely changed the way that I understand acupuncture. It has completely changed the way that I practice acupuncture. And I feel it is far too important and far too pivotal to not share this with my acupuncture community. I hope to have the opportunity to share with you some of the advanced neuropalpation and neurostimulation techniques based on canonical acupuncture points. And I hope to get you excited once again. Okay. In practicing acupuncture, in my humble opinion, the way that the original acupuncture authors of the systematic canon had intended. Thank you.